So, Josh, how does a stroke occur?
A stroke occurs when the blood is cut off from the brain due to a blood clot or sometimes arteriosclerosis.
So, Josh, why don't you tell me the symptoms of having a stroke?
When you have a stroke, some of the symptoms are they cause intense headaches, unconsciousness, vertigo, change of hearing, and in dramatic cases, even a coma.
Wow, those are really bad things. Are those the only symptoms? Are there any more?
Yeah, it also causes a loss of memory, coordination, balance, bowel control, vision, and the ability to feel pain.
So, Josh, what would cause a doctor to diagnose one of their patients with a stroke?
If a stroke is expected, they would have to take a look at the blood pressure, the problems in reflexes, movement, and the problem in speaking.
After diagnosing a patient with a stroke, what could the doctor do to help treat it?
A patient would have to be treated immediately for there to be any chance of survival. They would have to have a blood thinner and a type of clot removing drug for there to be any chance.
What's the most effective time for that clot removing drug mentioned before to be administered to the patient?
Anytime within the first 3 to 4.5 hours of being diagnosed.
Is there any way that a stroke can be prevented?
Certain strokes can be prevented, the ones due to lack of exercise, the wrong diet, and uncontrolled diabetes, but in some cases genetics play a huge role and those strokes are not preventable.
Alright, that's the last of our questions. Thanks for cooperating.
My pleasure.